Hello physios. The most common thing we see is swan neck deformity. I'll teach you with easy to remember. So which is flexion of MCP and DIP joint and extension of PIP joint. So don't get confused. So the PIP joint, which is proximal interphalangeal joint, which is middle of it. So we see the MCP and DIP. So MCP metacarpophalangeal, DIP distal interphalangeal. So both the middle has PIP, proximal interphalangeal joint. So only the PIP, the middle of it will go into extension. So the others two things, which is MCP and DIP, which go for flexion. So only remember the PIP go for extension, other two things go for flexion. So which leads to swan neck deformity. So due to the contracture of intrinsic muscles or tear in the volar plate causing this, so we can see it in rheumatoid arthritis patients or patients with trauma. So another thing is mallet finger. So don't confuse with it. It is different. So mallet finger only has DIP involvement, which is distal interphalangeal joint involvement. This distal interphalangeal joint will comes into flexed position. So no other things involved here, which is mallet finger. So due to the rupture or avulsion of extensor tendon, which is inserts into the distal phalanx of finger. So not other thing, only the distal phalanx. So when it's getting avulsed or rupture, then it leads into distal phalanx leads into flexed position. Flexed. Can remember like DIM, which is distal interphalangeal for mallet. So DIM. So remember DIM. So which is for mallet finger. Distal interphalangeal comes into this.